the recommendations of the Hidden Toll report, the Senate report into suicide in 2010. And this might be a question for Senator Nash to start with, I think. I note that the National Party's 2013 federal election policy platform included a commitment to implementing the recommendations of the Hidden Toll report. Is the Minister able to comment on the government's intention to keep that commitment?
Thanks very much, Senator. No, look, not at this stage. Certainly we're well aware of those issues, but not at this stage.
When you say you're well aware of those issues, do you mean the issue of the National Party making that pre-election commitment?
I mean, the issues contained in the report, but it would be a matter for the Senior Minister, and I'm happy to take that on notice for you.
All right, thank you. I would like to know whether the government, leaving aside that particular issue of a pre-election commitment, does the government have any intention to implement the recommendations of that report at any time, and what sort of time frame might that have?
Again, a responsibility of the Senior Minister, and happy to take that on notice, Senator.
Thank you. All right, I'd like to ask some questions now about the fact that it's emerged that there'll be around about maybe $20 million, arguably possibly more, of mental health program funding which will have its indexation frozen for up to 4 years. Is that correct? And I'm not sure who can answer that in the department.
I'm not sure, Senator. So can you give me some more
information about that? I might have to wait and get
yes,
some more information
if you could give us some more information around the specifics and the specific programs, then very happy to
There is a reference to a document, but I don't have that handy, so I might have to get that through to me. I might ask my staff to do that for me. Thank you. I'd like to come to the issue of eating disorders, please. And I'm interested to know what data the department has in relation to the prevalence of eating disorders in Australia in 2014 or recently.
Again, we would need to, I don't have that information on me, Senator, I'm afraid. We would need to take that on notice and just see who the appropriate organisation is who collects that type of data, and but we can certainly look into it and happy to make that information available.
All right. When you say the appropriate organisation, forgive me, would that be a part of the department or an NGO?
That's what we will look at.
Okay.
Yes, I don't have that eating disorder information with me at the moment, but I'm aware that a number of different organisations and a number of different NGOs work in the area of eating disorders, but I'm not clear, and I can't think off the top of my head whether there's a consistent data collection across all of them to actually pull that information together, but I will certainly look into it.
All right, so perhaps the next question, which is a follow-on question then, is what is the current level of government funding allocated to address eating disorders in Australia?
Yes, I'd need to take that on notice, Senator.
All right. And if you could separate that into direct and indirect funding, thank you. And if I could come back to some questions in relation to the advice that the, I guess what I'm interested to know is what kind of... There's been a lot of concerns raised about the potential effects on mental health and mental ill health of young people particularly, who will be subject to proposed changes under the budget in terms of New Start allowance not being able to be in receipt of payments under New Start and so on. So I'm interested in what consultation and work might have been done between the Department of Social Services, who have the carriage of that particular legislation, of course, and the Health Department in relation to those proposed changes to welfare and the impact those changes will have on people with episodic mental illness, for instance. Was there any consultation undertaken? Was there any advice sought from your department?
Again, I'd need to take that on notice. As you said, this was an initiative that other agencies do, and I know that they run a number of their own mental health services and various areas, but I don't have the answer to that question, I'm afraid, Senator. Okay,
so I'm trying to work out how government operates, I suppose, executive government, and so I'm interested in terms of the consideration of those budget measures which were proposed in the budget. Was there any procedure in place whereby the Department of Health which is the federal government department that's responsible for mental health programs and mental health data, was there any procedure whereby the department itself had its advice sought or any modelling done from the Department of Social Security or the government in terms of those proposed budget measures?
Again, I'd need to take that on notice, Senator. I don't know the answer to
Okay,
that.
and go on.
Sorry, I was going to say in terms of general budget areas, it's not this division that would look at issues around general budget issues or
Yeah,
decisions.
and I suppose it's not specifically necessarily a financial issue.
Yes,
I guess I'm
yeah,
interested
it's
in
impact.
what I think people increasingly are seeing as a concern is the silo approach
Yes,
to
yeah,
governing,
yeah,
whereby
yeah.
something that seems like a good idea to some people might have
Yep.
predictable flow-on effects, not just financial but human.
Yep,
And
yep.
And so that's why I'm interested in when you respond and say there may be some NGOs or some other organisations that are doing this work. I'm also interested in understanding what the role is of the Department of Health in terms of that work, or pulling that information together and
Sure.
giving good advice about
Yep,
policy.
yep.
So
Yep.
if you could take that on notice, that would
Yep.
be good. Does the Department of Health plan to offer any programs or any training to the Department of Social Security in relation to young people with mental illness to ensure they aren't properly cut off their benefits? Would it be envisaged in any way that the expertise that the Department of Health might have could be utilised in that way?
Senator, there's no specific plans for training to be offered by the Department of Health to other departments. In that way, we wouldn't do that kind of training. No.
No? All right. I'm interested in whether the department or indeed the minister is aware of recent research which indicates links between austerity measures that have been undertaken in other countries, for instance, and an increase in suicide rates. There are some publications that have come out recently. Is any work being done in that area, or is there any information that's known to the department or the minister?
There would be, I think, as you know, the issue of suicide is one which is a kind of multifaceted issue, and really suicide rates, we know, are impacted by a whole host of different societal areas. We are aware of research that is done both within Australia and internationally around suicide rates, particularly among different groups and different areas. And as you know, the government, through its Taking Action to Tackle Suicide policy and the suicide prevention programme, does fund a number of different organisations, quite a large number of organisations, to work within different groups in society and also within different areas to try and minimise the impact and to do as much work on suicide prevention as possible. It's quite a wide question as to, research has been done, so we're aware of a lot of research that's been done, and we use that to inform policy and use that to inform policy advice to government.
Yes, I'm just interested in what policy advice to government has been requested. And the reason I'm asking it is that there has been significant concerns raised by credible and experienced mental health commentators throughout Australia in response to particularly the proposal to changes to New Start for young people under 30, the consequences of, if the legislation were to be passed, of them not being in receipt of income for periods of up to 6 months. And it is, I think, a really important issue to know whether or not the Department of Health has had any input or is using any of its resources, not generally to talk about suicide, because of course we're all concerned about suicide and strategies, but the fact that there may be a government policy that could inadvertently lead to such a significant consequence. So I don't get the feeling you're going to be able to answer my question in any more detail at this point, but I'm specifically asking about research in Scandinavia and other places that have linked austerity measures to an increase in suicide rates among the population. You're not aware of anything like that specifically?
No, certainly we are aware, as I said, we are aware of research that links suicide rates through to various different areas.
Well, what
and
about that
different
particular issue then?
I've not got off the top of my head, there's nothing that I've read in particular from the Scandinavian research that I've looked at very recently. As I say, certainly there is a lot of Australian research that we do look at and that kind of thing, but I'm not aware of the Scandinavian research. Having said that, I'm not across all the research that comes into the department, and I
Yes.
can certainly have a look and get some advice from our experts in the mental health area to see if they are aware of research that's been done overseas, particularly in Scandinavia, to do that. The other comment I would make is that there is often interdepartmental working on some of these issues, yes, but I don't know the specifics around that particular area as to what work was done and what happened there, so I'd need to look at that.
So you'll take that on notice for me.
Senator.
Thank you. That's really what I'd like you to do. Thank you very much, and let me know whether, and also perhaps help me understand, is this the sort of situation where, and forgive my ignorance about how government departments work, but is this a situation where you would have to wait to be requested to provide that kind of input? Or if there were people within your department who were concerned about that, and it's within your rubric, I suppose, they could actually offer to provide information or policy advice across to another department. How would that work?
I'll have a look at that.
Have a look.
Senator.
Okay,
Yeah.
thank you very much, Mr Booth. And look, I would like to come back to those other questions at some point. I'll just quickly get them, but I'll pass now. Thank you.